more than 1/3 of Canadian babies do not have access to comprehensive infant hearing healthcare services. Hearing loss can be supported and delays avoided if it is caught early and supported early. A postal code should not determine whether or not an infant has access to infant hearing health services. My name is Marlene Bagatto. I'm an assistant professor in the School of Communication Sciences and Disorders and the National Center for Audiology at Western University. My role has been as the chair of the Canadian Infant Hearing Task Force for the past 6 years until recently when my term ended. I'm a trained audiologist. In particular, in my clinical work, I worked with children, and that has supported my interest in my teaching and research areas of pediatric audiology. Infants are ready to learn as soon as they're born. Their brains are like sponges, and one thing they need to learn is language. And knowing language supports literacy, social emotional development, and cognitive development. So the early identification supports early intervention that we can provide so that there are no delays for children who are born with permanent hearing loss. The problem is that there are not comprehensive infant hearing health care services in every province and territory in Canada. So according to the 2024 Early Hearing Detection and Intervention Report Card, 6 out of 13 provinces and territories have all of the 5 components of a seamless system of services for infant hearing healthcare. The first is universal hearing screening of all newborns born, regardless of whether they have a risk for hearing loss. If they do not pass that screening, they will get an assessment at a few weeks of age from a pediatric audiologist to determine the status of their hearing. If permanent hearing loss is detected at that stage, supports for technology like hearing aids and cochlear implants, as well as language, either spoken or sign language, is provided. Throughout the process, family support is offered, so families aren't searching for who to go to see, who has the skills to work with these babies, and have the expertise to ensure that the baby is supported well so that they can develop on par with children who have normal hearing. And finally, these programs must have a database and a way to track children and families through the program so they're not missed or lost, and also so we can monitor how the program is doing. The impact is babies born in these provinces and territories are offered this service from birth. And if there is an issue that's detected, they are offered the supports necessary. The federal government needs to take a policy leadership role and provide resources and supports to the provinces and territories so that they can develop and implement comprehensive infant hearing health services. Remember that hearing loss is invisible. We can't tell by looking at a baby whether they have a hearing loss. So having the mechanisms right from birth to detect that is possible, and we can improve and mitigate the impact of hearing loss if it's detected at a very early age. So if you'd like to learn more about whether the province or territory in which you live provides comprehensive infant hearing health services, please go to the Infant Hearing Task Force's website.